Hello and welcome. I'm Tammy Yost and I'm here at Restorative Health Care. I'm talking to Dr. Heather Wisniewski, owner, operator, and chiropractor here at Restorative Health Care. Say hello, Dr. Heather.
Hello.
I have some questions from patients, and today's question, I'm going to start off with, I spent a lot of time outdoors in the sun, probably golfing or having a good time. Do I still need to take vitamin D?
Absolutely. We do not get D from the sun. The sun does
Really?
not give us vitamin D.
Okay.
Vitamin D is only activated by the sun, and unless we have enough in storage, can the sun activate it. If you are using any type of sunscreen or special clothing that blocks the sun, it's not activating your D stores if you have them. The study that was done in Canada found that most people were significantly deficient in vitamin D. Here in the United States, there was an argument with the AMA and of course Canada in regards to what those levels should be at. The ARI, or Autistic Research Institute, states that we want a minimum level of about 85 for optimal health. Current lab tests put it at about 30 to 40 minimum being needed for optimal health, and if you get anywhere near 85, the medical doctors start to worry. The ARI states that you want that level to be somewhere between 85 and 135 for most optimal health.
Now, I see that vitamin D is added to things like milk and orange juice. Is this going to help me get the vitamin D into my body?
No, because of the form that it's in. It's not a form that's active. You need an active form, which is called D3, if you're going to actually not be out in the sun, or you're not going to be taking in a form that can actually be converted by the sun into D3, which our body utilizes.
Okay, so you have to have it in your system, then the sun activates it.
Correct.
Okay, so it doesn't matter if I spend all day out in the sun if I don't have it in my body.
Correct. They actually did a study on tanning bed people to see if they had more D3. They were just as deficient as everyone else in society.
Well, now that it's getting on winter, I'm not out in the sun activating it. Would I need to be taking more vitamin D in the winter?
Absolutely. There was a study done that actually looked at West Coast, East Coast, North, and South. And our particular region requires about 2,500, between 2,000 and 2,500 milligrams of D3 during the day in the summertime. Coming fall and winter, we need about 5,000 milligrams daily.
Now, I'm understanding now that I need to take it into my body, and can I get too much of it?
Absolutely not. The ARI did a research study to see how much vitamin A and D, because those are your common fat solubles along with vitamin E. We would literally have to take 5 million units of vitamin D daily for 6 months before it would actually become toxic and cause any type of damage to the liver. And most of us are actually going to be burning it up in our immune system and other areas as digestion, because D3 isn't only used in regards to cancer, which is the big hot item why everybody's taking it. It's used by our digestive tract. It's used to help get calcium into the bones. It's pretty essential for joint health, so it's a more important vitamin than people are realizing. And so toxicity is probably not the number one thing we should be worrying about as much as deficiency.
Right, I was just going to ask what types of things vitamin D is beneficial for, because, we do hear a lot about vitamin D. And like I said, they start adding it to foods now. So you're saying that it's helping in the digestion as well?
Absolutely, especially in the small intestine where absorption of D3 is actually pretty necessary.
Great. Is there anything else I should know about taking a vitamin D?
Yes, you want a good form of D3. A lot of the D3s that are over the counter that people are buying have D2 and other forms that aren't actually convertible or actually usable by our body. You want the active form, which is D3, and a good form that's been tested and proven to be that is what you want to look for, a standardized form.
Great. Is there anything else you'd like to share about D3?
I think that everyone should be on it. I think everyone can use it, and it's a great preventative for cancer.
Great. Thank you very much, Dr. Heather. I'd just like to remind everybody that here at Restorative Health Care we do carry vitamin D, and you can come in and pick some up. Thank you so much.